Hello friends, and today we are going to study the collarbone, also known as the clavicle. First we will look at the basic questions that are asked in viva. First is, which type of bone is clavicle? It is a modified long bone and it has two ends, that is the medial and the lateral end, and the shaft, and having S-shaped curvature. It has no medullary cavity in it. I will explain it. So this is clavicle. Clavicle has a sternal end and an acromion end. The sternal end is circular and is attached to the sternum, the upper part of the sternum bone that is placed in the midline of the chest. This is the acromion end. It is named acromion end as it is getting attached to the acromion process of the scapula, as you can see here. So this is clavicle, this is the scapula, this is the acromion process of scapula, and this is the humerus. These are the three major bones that make up the shoulder joint. So clavicle is a first bone that is going to ossify in the fetus, and it has a superior surface and the inferior surface, anterior border and posterior border. So we will see the attachments. Before seeing the attachments, we will see the peculiarities of the clavicle. So clavicle is the only long bone that is placed horizontally in the body, and it is devoid of medullary cavity. That is, there is no any medullary cavity present in the bone. And it is the first bone to ossify, as I said before, and it is ossified from membrane and is subcutaneous to up. It is pierced by supraclavicular nerve that is placed above the clavicle. And we will see the main thing that is asked in anatomy mostly, that is the side determination of the clavicle. In order to determine the side of the clavicle, as I said before, we should remember the two things, that is the medial end and the lateral end. So this is the real bone, and this is the medial end, that is the sternal end, and this is the acromion end, which is flat. With this we can recognize that this is the right clavicle, because the sternal end is placed medially and the lateral end is placed laterally, that is away from the body. So we can see a elevation and then a depression. So this is the structure of the clavicle. So this is the posterior surface, having the only groove that is present posteriorly, that is the subclavian groove. So we will see the bony parts that are present there. So this is the acromion membrane, as I said before, and this is the trapezoid line or ridge, and this is the conoid tubercle that is present in the inferior surface, and this is the sternal end, as I said before, and this is the subclavian groove. It is named subclavian groove because the subclavius muscle is getting attached there. We will see what are the bone that articulates with the clavicle. That is the sternal end, that is it articulates with the sternum, and it is a variety of synovial joint. The acromion end that articulates with the acromion process of scapula to form the acromioclavicular joint in the scapula. Okay, so this is the pictorial representation of that. So this is the acromioclavicular joint here, and this is the clavicle bone. It is placed like this in the upper limb, and this is the sternoclavicular ligament that is providing a stability for the clavicle as well as for the sternum. So we will see the attachment in the superior surface. This is the sternocleidomastoid, which is a strap muscle, the primary muscle for the movement of the neck. This is the sternocleidomastoid muscle origin, and this is the trapezius, the neck muscle, the posterior neck muscle. The trapezius gives insertion in the acromion end, and this is a deltoid muscle. This is the anterior fiber. Totally there are three fibers for the deltoid. There is the anterior, middle and posterior. This is the origin of the anterior fibers of the deltoid. And this is the pectoralis major muscle, the primary muscle of the pectoral region. It gives origin here. This is the inferior surface. Here we can see the same pectoralis major, and this is the sternal end, and this is the deltoid muscle same. We have a ligament called the costoclavicular ligament. The costoclavicular ligament connects the ribs to the clavicle, and it is getting attached here. And as I said before, the subclavius muscle is getting inserted in the subclavian groove. And this is the conoid part of corococlavicular ligament, and this is the trapezoid part of corococlavicular ligament. This is the anterior and this is posterior border, and this is the these are the main attachments present in the inferior surface. Next is, which is the most common site of fracture of clavicle? It is a junction between the medial two-third and the lateral one-third of the bone, the junction between the two curvatures of the bone. That is here. This is a junction where the clavicle get fractured. So this is the medial one-third, lateral two-third. Next is an applied anatomy, that is the cleidocranial dysostosis, that is the congenital absence of the clavicle bone. So that's it.